Yep.
So here we are. We're just sitting here in the middle of the butt muscle, in the middle of the glutes, and we're just kind of moving back and forth, just letting that tissue slowly open up. And then from this position, we bring our hands back. We're going to cross our right leg over the left, and here we want to open up that piriformis muscle on the right side of your butt, and we're just leaning in. You can bring one hand on the roller here, and we're just going to move back and forth until you feel any kind of pain in that area. And when you locate that area that may be causing pain or discomfort, just stay there for 30 seconds. And you can just roll over. You can also, from this position, to get more leverage, you can come over onto your forearm as you're moving back and forth through the gluteal muscle. From here, we can bring the leg out straight as we start to move down into the hip, onto that IT band, moving all the way from the hip all the way down to the knee. This area can become extremely sensitive. This IT band is a very sensitive area. This is a wonderful stretch. You can move over, rolling over to the front of the quadricep, all the way up to the top of the hip. Usually one time up and down will do it. If you feel there's a certain spot, sometimes you might stay there for 30 seconds, sometimes for a minute. And then we're coming back up. And then we repeat the same sequence on the other side, crossing the left leg over the right leg. Again, opening up that piriformis area on the left side, moving it across all the way down into that lower back area, moving into the side, again moving into that hip area, and start the roller coming all the way up down that IT band. Often you'll need to put some weight onto the foot because this is a very sensitive area. Working all the way down to that knee. Don't go into the knee, just above the knee is sufficient. Coming back, rolling it in. You can roll all the way over into that quadricep. If you feel there's an area that needs to be worked on more, you coming down onto the forearm, and that should be sufficient to open up that fascia tissue. Okay, cut.
Go.
Now we opened up the fascia tissue. Now we want to move into a little bit of mobilizing and stretching. So we come down on the mat, keeping our knees bent in this position. We're going to bring our right leg over the left leg, bringing our arms out to the side, and from this position we're rolling all the way over to the left side, keeping the shoulders down. And here you can take a couple of deep breaths in. You can also use your left arm to open up that, and then coming back to the center, and then repeating the same sequence on the right side, coming all the way across, keeping that left shoulder down. You can also use a hand to add a little more pressure as you come over onto this side. After you've done this stretch, we can do a little mobilizing movement, just bringing the knees up like so, and then from here rolling from side to side. It helps to strengthen muscles there in the abdominals into the oblique area, and just rolling side to side, keeping the arms active, stabilizing your body as you go. There's an advanced version of this which is called window wipers, as your legs are out to the side like that. But in the beginning, for beginners, it's better just to keep the knees up, moving from side to side like so. After we've done that, bringing your arms back to your sides, we bring our right leg across like so, moving the knee away from the body, and then reaching through this hole in the knee here, grabbing behind the knee and just applying pressure also is a really good stretch for the piriformis on the right side. The people that are more flexible, you can hold the front of the shin bone into that position. Again, holding for around 30 seconds should be sufficient, and then switching to the alternate side. Reaching across, holding behind the knee joint. The people that really have a hard time with getting their hands behind the knee, they can just keep their knee in this position and move this knee away from the body and just try to pick up the leg and just pull it in as best they can. For persons with more flexibility, you can hold the lower part of the shin bone. Okay, cut.
Go.
Next we're going to move into a lunge stretch. Here we want to keep the knee behind the toe, keeping the hips square, and here we're just working on stretching the hip flexors. What we don't really want to do here is lean into the spine. That causes compression in the lower vertebra, and here we want to hold for around 30 seconds in this position, just to open up the hip flexors. And then switching positions, moving to the other side, keeping that knee behind that toe so that we don't put any strain in the knee joint. Keeping your chest lifted, your stomach slightly engaged. And again, we hold for around 30 seconds in this position. And then from this point, now we've gone into finished the flexibility aspect. Now we're going to move into some strengthening work. Now we've opened up the fascia tissue, we've stretched the muscles. Now the body's primed for movement, because it's no good just stretching the muscles unless you have some strength to hold the muscles in place. So now we're going to do a little bit of work on some muscle strengthening. And we're going to start with the squat first. We'll move to the side to give you a side angle on this, keeping your legs hip width apart, keeping your chest lifted and your abdominals engaged. And on this one, holding the medicine ball into the chest. We're going to we've come back with the buttocks coming all the way down, pushing into the ball down to 90 degrees, pausing on the bottom, and then squeezing up, and then extending the medicine ball over the head, bringing the ball back into the chest. Breathe in as we come down, coming all the way down to 90 degrees, coming up, extending, keeping the spine in a neutral position. And we would start with maybe 10 repetitions in the beginning. I'll show you that from the front angle. Keeping our heels on the floor, the chest is up, the stomach is tight, the hips are square, and you're pulling your butt away from the body, the chest is lifted, the head is up, you're squeezing into the ball. That helps you keep your abdominals contracted, coming up, and then squeeze. What we don't want to do is lean into the spine. This is bad, it causes compression. Breathing in as we go down, all the way down to 90 degrees, coming up, squeezing up, using the glute muscles to get you up, coming down, up, and squeeze, and about 10 repetitions on that movement would be sufficient.